Hi, I'm Dr. Carson Felkel, a child, adolescent, and adult psychiatrist at Bon Secours Mercy Health.
And I'm Dr. Aimee Drescher, a clinical psychologist at Bon Secours Mercy Health.
Thanks for joining us today. We're going to be talking about the CDC COVID-19 prevention guidelines as it relates to our kids returning to various forms of education. And we're not just going to be talking about the guidelines around the 6 feet of physical distancing, the different state opinions on mask wearing, the cohorting of students, the hand hygiene. We're going to be talking about strategies that we talk with our kids about, how to get them to learn these techniques that are so important to keeping us safe. Aimee, I know that you and I believe in the science and the evidence behind these recommendations, but you're in a really unique position because you're married to a school principal. You're a clinical psychologist. What are the conversations like around the dinner table at night?
Well, Carson, thanks for asking that question. It can get a little heated sometimes. Overall, I would say we do talk a lot about sending kids back to school and different learning strategies. And, I've asked my husband, what do you think is the best way to handle this? I'm really relying on him to help us make some decisions about school for our kiddos. The one thing that he says is that absolutely it is ideal for kids to have face-to-face in-person learning. And some of the challenges that arise with that is when you send these kiddos back to school, the schools can do as much as they can possibly do to follow the CDC guidelines and create, safety. And I would say that our schools, the ones who are going back to in-person, are really trying to do that. The challenge is, how are parents and families doing this when kids are not in school? And that becomes more of the challenge. So, Carson, I would ask you, what are you doing with your kiddos? It's a really tough decision, I think, to make in figuring out what to do for this year.
Yeah, there's so many decisions to make, and there's not always a perfect solution. With my 3-year-old, I can talk to him as much as I want about hand hygiene, and he's going to still touch everything in the grocery store. And we've already gotten sick once, luckily not with COVID. But with the 6 and 10-year-old, we really have to have more conversations around the why behind the CDC guidelines, because we know that to remember things, that's the front part of your brain, but there has to be some emotionality, some emotional valence to remember it. You need to know why you need to remember it. And for them, the focus is on 2 things. It's one, seeing their grandparents who they miss a whole lot. And also in our family, we try to live a life of service. And so we've spent time talking about keeping other students safe at school who may have chronic medical conditions, or keeping our teachers safe, grandparents, anyone else who works at the school. We really want to do these things to protect them. What are you talking about with your kids?
I really appreciate that perspective, because I think, what we're doing is echoing exactly what you're talking with your kids about. It is a very real fear with teachers and administrators and staff at the schools. And we really are trying to instill in our kids that this is more about other people's safety, not necessarily that we're fearful that they are going to, become sick. And with, the 6-year-old, we talk a lot about, remember when you couldn't see, grandma and grandpa, and you couldn't see your, other extended family members, because we do have a very large family and we're pretty close. And so I think it motivates her to, to follow the guidelines. I would say also 6 is a little easier than 3. And I know that Carson and
teenager? What do you do?
I know. Well, I know we talked a little bit about that at the end of our last one. And honestly, with our teenagers, it's not a different strategy. I think it is just packaged a little differently, for developmental level. And so they can understand things a little bit differently. And also we have to validate with them that this is a really difficult time. When you're teenagers, you want to be, involved with your peers. And that is something that is very normal for their age group. So I think normalizing it and encouraging them to, to abide by, our family guidelines on top of the CDC guidelines, and letting them know it's not going to be forever has been really helpful. And again, though, it's not really a different strategy. We really do have to attach some emotion to what they're doing.
Yeah, and so you said difficult times. I think for maybe teenagers or even me, I need to be reminded that we're not alone in this difficult time. I was talking to my 90-year-old grandmother the other day. I haven't seen her. I miss her. And she was reminding me that we have had periods of difficult time in our society. She didn't see her husband during World War II. And not to say that what we're going through now isn't anything compared to what she had to go through. She was more making the point that, everything is relative. For maybe our kids that didn't know 9/11, this is the worst thing that's happened to them. And so we keep reminding them that this will pass. We are in this together. And we really have a sense of purpose to serve other people during this time.
Absolutely. And, I know we've had some requests for things to talk about, and I would love for us to interview your grandma when we talk about loneliness, and especially with our folks who are older. That would be a wonderful thing to do. Absolutely. Let's do it. So then our next one is going to focus more on helping teachers and school staff and parents who are acting as teachers at this moment identify when kids really need more help. So I think that's what we're going to talk about next time, Carson.
You got it. Thanks for joining, everyone. Take care.